I would like to begin by introducing our first award winner, who will present her story, Mrs. Magbule Doko. She is a resident, a winner of the award for stories by medical students or residents. Her story is, why are you here to see the doctor today? You will see the biographies of those awardees in your handout, and I would welcome Magbule to come either from your seat or from the podium, whichever you feel most comfortable.
I can read it from here.
Whichever you prefer.
All right, so the title of my story is, Why Are You Here to See the Doctor Today? Knock, knock. Take a breath. Hand on the knob. Meet and greet. Then comes the line. So why are you here to see the doctor today? Behind every door lies a story. Knock, knock. So why are you here to see the doctor today? The patient explains that he wishes to have bariatric surgery. I discuss the risks and benefits. I talk about the paperwork to be filled out. I notice in the chart that he has a past medical history of depression. I asked him about it and how are the medications working. He states that recently he lost his job and has been so depressed. His children are succeeding at school. He is worrying how he will pay for their university tuition. He told me that he recently had suicide attempts. His story is so sad. Why do some have depression? Good luck, bad luck. He has so many issues going on. Where do I start? He was thinking of suicide because of financial difficulties. Is he still suicidal? I need to tease that out. I need to let him know of the social supports in the community. I feel like I want to just tell him that everything is going to be okay, but I keep my cool and continue. Knock, knock. So why are you here to see a doctor today? An elderly gentleman has come to the office for a reassessment of his peripheral neuropathy. I reviewed the history of present illness with him, did a thorough neurological exam. He is a type 2 diabetic. As I continue with the interview, I ask him about his home life. He takes care of his wife. He can barely take care of himself. He tells me that his wife has bipolar disorder. There are moments where he is verbally abused by her. He begins to cry because he doesn't want to blame her. He loves her. I have never seen an old man cry. It was so touching. I was holding back tears. He loves his wife so much that he was hesitant to bring this up. He has caregiver burnout. This man can't care for himself. He hardly has any sensation in his feet. He looks like he is a very kind person with a warm heart. I want to tell him that. Why does he have to deal with this? If only I could cure all his problems with the tap of a wand, but I can only tackle his problems one at a time. Knock, knock. So why are you here to see the doctor today? A young married couple have come in today because last week they had a positive pregnancy test. This week it was negative. She had her period. I take a history regarding infertility. I talk to them about lab tests we can do to assess fertility. They have been trying ever since their first son died 5 months ago. He was only 2 years old. He passed from a rare disease. Why them? Look how strong they are even in these circumstances. Their child passed so recently. Are they still mourning? Have they come to terms with what has happened? Are they ready to have another child so quickly? It's hard to get pregnant after losing a child. I feel so helpless. I began to get angry that their child was taken from them. It was too late. The only thing I can do is comfort them and encourage their efforts. Knock, knock. So why are you here to see the doctor today? This patient has come to review their blood work results. Looks like high cholesterol. Risk assessment reveals that she is at high risk because her parents had heart attacks and strokes at young ages. She is currently on no medications. On physical exam, she has high blood pressure, which was also present at her last visit. I told her that she has hypertension and hyperlipidemia. Then I explained to her the long-term risks of these disorders if she does not take action. I then tell her that she must start 3 different pills and take them for the rest of her life. Then I pass her the Kleenex. This woman came into the office today thinking she was perfectly healthy. No pre-medical history, no medications. Now in 2 minutes, she has 2 diagnoses and 3 lifelong medications. I had to break it to her. Was I too harsh? She had to know. As her doctor, I have to help her prevent morbidity and early mortality. Her tears were tears of realization. I feel like I did a good job, but I forgot to consider how this would impact her. I gave her words of motivation. Behind every door lies a story. People come to their doctor because it is someone they trust. They need someone to tell them that everything's going to be all right and they will get through it. Their story is more than a medical problem. It becomes a part of their existence, and the doctor should realize that they need to treat the person, not just the disease. Thank you.
Thanks, Mag. Very insightful day in the life of a resident.